By 2050, Europe will have 173 million people aged 65 plus. 18 out of the 20 countries in the world with the highest percentages of older people are in Europe. Many old people are limited in their homes or institutionalized and left to face social exclusion. The quality of life that is imposed to the elderly is low and is further aggravated by cognitive degeneration and lack of opportunities to actively participate in society. LLM is a European project that comes as a response to these problems, offering the elderly an opportunity to improve their cognitive and physical condition and to continue feeling an active part of society.
Basically, the long-lasting memories aims to build, develop an integrated ICT platform which will combine state-of-the-art cognitive exercises with physical activity, physical exercises, and this will be done in the framework of an advanced ambient assisted learning environment. And LLM will offer basically support to the elderly people, but also the relatives and their families in three ways: by monitoring day-to-day activities of senior citizens and identifying imminent hazards. It will also assist them to maintain their functionality in everyday tasks and communication. And basically it will increase their self-esteem and alleviate symptoms relevant to cognitive decline and the loneliness and the potential depression that all these things can bring.
The LLM platform is designed to comprise three existing interoperable components: the cognitive training component, the physical training component, and the independent living component. The cognitive training component is designed to support cognitive exercises provided by specialized software. Two such programs will be used for the LLM project: the Brain Fitness Program by Posit Science and Gradior by Intros.
So, Brain Fitness Program is a program to enhance neuroplasticity through adaptive computer-based cognitive training programs to practice sensory discrimination abilities in the domain of verbal processing. Why verbal processing and verbal memory in particular? Because it is a very important component of function in daily life. So the Brain Fitness Program has been developed to employ these principles into a set of hierarchically structured exercises that span the range from basic signal processing of sounds to discrimination of acoustic contrast between consonants, to memory for sequences of syllables and words, to following instructions, and to understanding stories.
The most important area of Gradior is the capacity of cognitive training, and we work depending on the needs of the patient. The exercises are follow one another, and we mix the attention, memory, perception, the different types of exercise, but this mix we can manage. Depending on for example, when we work with, for us it's important to establish difference between people who memory complaints, for the people suffer memory complaints or memory difficulties, function mild cognitive disorder, or people for properly dementia.
The physical training component, PTC, consists of custom training equipment according to specialized needs of the elderly.
The name of our game platform is Fit for All. This is an extra gaming platform which helps elderly people to exercise and maintain their physical status and well-being through an innovative low-cost ICT platform which is combined with peripherals and simple computer games.
Fit for All integrates through its environment a set of games and exercise routines with which seniors interact dynamically. The games developed are quite simple to understand, challenging and well suited to the special needs of the third age.
This is the Arcanoid game. The user moves sideways and hits the ball towards the bricks.
Fit for All incorporates predefined training routines, which are designed taking into consideration national guidelines regarding physical exercise in the third age, including exercise types such as balance, aerobic endurance, strength, and flexibility. The Independent Living Component, ILC, is based on the eHome system, which is a network of distributed, wirelessly operating sensors connected to an embedded system, the eHome Central Unit.
So there is a backlog of needs on safety and comfort in our houses, especially in homes for older people, or also for handicapped people. There's special needs for living longer autonomously at our homes.
It includes features such as intelligent learning of normal and exceptional patterns of behavior, dangerous situations or indicators for emerging health problems, relevant alarms, and, as an optional component, control of environmental elements typical of a smart home.
No, it's okay.
So,
okay, thank you.
okay, thank you for now. We might need you a little bit later as well, because we're doing this in small groups now, so everyone can get their hands on.
The LLM service will be tested in real-life situations. 4 consecutive rounds of testing will take place in 5 EU member countries: Austria, France, Greece, Spain, and Cyprus, for a period of 15 months.
So it's not just a test of technical accuracy, but it's a holistic process that we're going through in the pilot. The methodology is this: we have a 1-year pilot program scheduled in 5 countries. We have a detailed pilot execution plan that each country has created for how they're going to go about executing that, the place where they're going to conduct it, what types of users they're going to recruit into the pilot program, all of those various elements. They've also gone through an extensive process at looking at national legal and ethical guidelines to ensure that we're in compliance in each country with what is required for research with human subjects, and in this case in particular, a vulnerable population being elderly people.
As our population that we will be targeting is an elderly one, the ethical issues are extremely important, and we have tried to do a tremendous amount of work to ensure that elderly patients get the proper care that they deserve.